Imagine a child who throws intense tantrums, refuses to follow instructions, or lashes out in frustration. Their parents feel overwhelmed, exhausted, and unsure how to handle the situation. Traditional discipline methods, timeouts, yelling, or consequences seem to make things worse, not better. This is where parent-child interaction therapy comes in an evidence-based approach that does not just focus on changing the child's behavior, but strengthens the relationship between parent and child. PCIT was developed in the 1970s by Dr. Sheila Iberg, who recognized that parenting practices and child behavior are deeply connected. Instead of just addressing the child's actions, she designed a therapy that teaches parents real-time strategies to improve communication, set effective boundaries, and reinforce positive behaviors. Research has consistently shown that PCIT is highly effective in reducing behavioral problems, with long-term benefits that extend into adolescence. In fact, studies indicate that 80–90% of children with disruptive behaviors show significant improvement after completing PCIT. So, how does PCIT work? Unlike traditional parenting classes, PCIT is a live coaching therapy where parents and children interact in a structured setting while the therapist guides the parent through an earpiece or one-way mirror. The program is typically divided into two main phases. The first phase, child-directed interaction, focuses on building a strong, positive bond between parent and child. Parents learn to engage in special playtime using techniques like labeled praise, reflection, imitation, and enthusiasm. Instead of criticizing or directing the child, parents are coached to describe what the child is doing, reinforce positive behavior, and ignore minor misbehaviors. This reduces defiance and increases the child's sense of security and self-esteem. For example, instead of saying, "Good job," a parent practicing CDI might say, "I love how carefully you are stacking those blocks." This type of specific praise increases the likelihood of the child repeating the positive behavior. Studies have shown that just 5 minutes a day of CDI can lead to significant behavioral improvements over time. The second phase, parent-directed interaction, focuses on discipline and limit setting. Parents are trained to use clear, consistent commands and effective consequences. One key PCIT strategy is the warning system, where parents give a clear instruction, followed by a 5-second wait period. If the child does not comply, they receive a brief, structured timeout with minimal emotional reaction from the parent. The key here is consistency, no threats, no yelling, just firm, predictable consequences. One of the most compelling studies on PCIT involved children diagnosed with oppositional defiant disorder. After completing a 12-week PCIT program, over 70% of the children no longer met the criteria for ODD, and parents reported significant reductions in stress and conflict at home. PCIT is particularly effective for children with ADHD, anxiety, autism spectrum disorder, and trauma histories. A study at the University of Florida found that children with ADHD who underwent PCIT showed better impulse control and emotional regulation than those who only received medication. Another study focusing on children with PTSD found that PCIT significantly reduced trauma-related behavioral issues and increased parent-child attachment security. One of the biggest misconceptions about PCIT is that it only works for young children. While PCIT is most commonly used for children aged 2 to 7, newer adaptations, such as PCIT-T and PCIT for older children, have been developed and shown promising results. Another misconception is that PCIT is just about obedience. In reality, the heart of PCIT is building trust and connection. It teaches parents how to engage with their child in a positive, meaningful way, helping children feel safe, understood, and valued. With the rise of telehealth, PCIT is now being successfully delivered through virtual platforms, allowing therapists to coach parents in their own homes through video sessions. This has made PCIT more accessible to families who might not have access to in-person therapy. At its core, PCIT is about breaking negative cycles and replacing them with a foundation of warmth, trust, and structure. When parents and children learn to communicate effectively, power struggles decrease, emotional bonds strengthen, and family life becomes more harmonious.